Good day, friends. This is the second video of the series of policy making. In the first video, we have already discussed how to create a policy step by step and what is the need for making the policy. In this video, we will discuss how we can implement the policy because it is the step where most policies fail. Because implementation is the crucial step after making the policy. Because writing a policy is very easy, but changing the behavior and the culture is difficult to implement. So, when the policy is made, and the first step in making the policy implemented and work is the effective communication. Because after making the policy with the stakeholders, healthcare leadership, quality management at the patient safety department, don't just upload the policy. You have to share the policy with the stakeholders and, in general, healthcare providers, including the physicians and the nurses. And if the policy is updated, share the key features and what are the changes that have been developed. What are the clinical pathways that have been changed? What is the new requirement in this policy and why it is changed, why it is updated. Announce this formally. Explain why it matters because the people follow the purpose, not the documents. Now, how this communication is done? Every healthcare staff, healthcare providers, physicians, and nurses and allied healthcare workers which are involved should be trained and demonstrated the policies so that they should know their own role and their part in the policy where he or she stands. She should or he should understand the policy. They are practically trained through demonstrations, case scenarios, and there should be assessments the people have understood the policy or not. How the training is done, not only by the lecture, it should be done on the bedside. It should be done while the patient is on the clinical pathway. For example, admission policy. The patient is admitted up till the patient is discharged. This is the clinical pathway, and the healthcare providers of every unit should be trained in these scenarios so that they should understand what is their own role and what are the roles of their colleagues and what is the purpose of making this policy. When he or she will see the smooth flow of the healthcare journey of the patient and their own functional work, then they will realize that keeping this policy in function, in working, is essential for its own safety and the patient's safety and the healthcare outcome. So, this policy is integrated in day-to-day and daily work basis in every action of the healthcare provider, including the physicians and nurses, leadership, and all the healthcare providers which are concerned with the treatment and management of the patient and their outcome, so that the policy should not be ignored but it is encarved, it is embossed in the culture of the healthcare facility. So after implementing the policy, after the training and everybody is involved and it is documented, it is approved, how can you see this policy is working? Because if something is not measured, it cannot work. So the clinical audits, uh, performance indicators, observations, rounds to see actually that actually it is working or not, or it is the part of the culture of the healthcare facility or not, or it is only in the paper. Now, the policy is developed, the policy is implemented, daily observation of the policy is done for every level of the unit, department, all over the facility. So now invite a healthy feedback from the stakeholders so that the gaps should be identified and it is molded in an appropriate way. It is revised, updated. So a good policy evolves with the practice and upgradation, not as a static thing. So the policy is not a static thing, it can be revised and updated. Although most of the policies are developed for a period of 2 years or 3 years or at least 1 year, but this can be updated after the provisional observation of the policy and after a lot of feedback from the healthcare providers and the stakeholders, or sometimes from the leadership also, or the quality management and patient safety department guide after audit that it should be updated in this manner, or this part of the policy needs an upgradation or revision. Now, let me clarify some of the mistakes, and these mistakes can be avoided. Some realities we have all seen that the policies which are copied from other institutions or hospitals or healthcare facilities which are not in alignment with our or the same healthcare facility where the policies have been developed. So they are overly complex and not coincides with our alignment of the workflow. And so the training cannot be done on this because there are differences in the workflow. And so policies cannot be implemented, so it cannot be accountable. People cannot be held accountable. So these are not the policy failures. These are the failures of the system. So to have a valid policy, a healthcare institution should have to develop the policy of their own according to their own circumstances, according to the international benchmarks and clinical pathways, and with the best practices according to the hospital's own circumstances, so that they cannot exceed their scope of service according to their alignment of the clinical pathway guidelines. So let me leave with one thought. A policy is not successful when it is approved. A policy is successful when it is practiced. If we truly want safer patients and better outcomes, with a stronger systems having the healthcare policy, then we must move from this phrase that we have a policy to the phrase we are saying that we follow the policy. Thank you for your attention, and I hope you understand the development of the policy, the implementation of the policy, and the continuous workflow for the policy. Thank you.